Anticipated staffing needs, you have call-outs, you have patient censuses that will increase or acuities that change. And very often you need to be able to respond to the staffing needs for this institution. And often what happens, on 5 shifts a week, you have a scheduler that's on site. But for the other 16 shifts a week, you have a nurse supervisor in the majority of the instances making a phone call to find a nurse or a nursing assistant or even auxiliary staff to be able to help. These calls, the best they can do is 30 calls in an hour. My system can call hundreds of nurses and have a response in under 3 minutes. I did it live on stage at the Health 2.0 conference in San Francisco in under 30 seconds. Kaiser Permanente reports that in Los Angeles they have 4 full-time schedulers on all 3 shifts in their LA hospital that make over 100 phone calls per each shift they try to fill. So an hour and a half of time they spend for every call out, and they run, again, 4 full-time equivalents to be able to do that round the clock. Routine and emergency communications. When they did the swine flu emergency, state of emergency this year, it was declared an emergency. Part of what happened with that was continuity of operations plans. A big part of that is communications. You have to be able to communicate almost in real time with your staff to be able to allocate them where they're needed or to be able to stop transmission. If you had a verified case of something in-house, you could stop people from coming in, tell them to get their protective gear on, and more importantly, be able to prove that you did tell all of these people to help save their lives or prevent disease transmission. And so another piece of this is compliance, documentation, and reporting. In a union situation, if you have to call by seniority, or in an emergency situation where you want to be able to prove you did everything in your power reasonable to try and help and notify everyone you can. You can do these things, and it's just like nursing or medicine. If you don't write it down, it doesn't exist. You can't prove it. It becomes a he said, she said. Well, now you can print a report, go into a union grievance meeting, and have it resolved in seconds instead of hours. Some of the recent findings from a Cisco study in 2009, they were talking about electronic health records and patient health records and how our focus is on this and spending millions and millions, if not billions of dollars to make these transitions. What they found is if we spent money on in-house communications and made the efficiency of being able to talk to who you needed, when you needed in the hospital, that you would have better productivity, patient safety, patient experience, quality of your work life, and patient throughput or flow, the hospitals call it. The amount of impacts on these things are incredible. 82% said that the impact of communication lapses on their day-to-day practice. 82% said they have a very high impact on productivity. 77% said on patient safety. Patient experience. You want your patients to come back to your place and recommend you to friends? 77% of them said, 74%. I can't get in touch with who I need to be able to continue this care, and it's taking time out of my day that I could have given to a patient as nursing care or to an advocate type of a situation. Cisco looked at that and said we could save millions and millions and millions of dollars with a much less investment, even though we keep focusing on electronic medical health records and patient health care records. Every single day in every single institution, you need to contact hundreds and hundreds of people as part of the day-to-day operation. And we can do it in seconds instead of hours. We allow you to instantly allocate staffing resources. If you need a respiratory therapist to come on, you click, I need a respiratory therapist at 3 o'clock to work, say, the specialty ward. You want them in a high infectious disease ward or pediatric ward or labor and delivery. You can specify what skill sets you need. The system will look at who's available, how they like to be contacted, phone, text, or email, sends out the communication to everybody that meets that requirement, and they can respond immediately on any of those channels. The first response is confirmed. The other folks are told, thank you for inquiring. We'll notify you with the next opportunity. This happens again in seconds. Provide immediate staff communication, emergency or routine. Document all your communications effortlessly. So this results in increased patient and staff contact time, which is the #1 indicator of patient outcomes. Nursing contact time is the #1 indicator of your patient outcomes. The more nursing hours that you can provide your patients, the better your outcomes are, period. Improve employee retention. We're a collaborative communication system. You quit calling nurses that are unavailable at times that they don't want to be contacted. I have a story. I was actually at my wedding, about to walk down the aisle and my phone vibrates, and it's a nursing agency trying to get me to work that night. I explained I'm about to get married. They said, Matt, please do this for us. We'll cover you. I hung up. Decrease absenteeism, agency usage, and overtime. You want to see administrators cringe? Talk about absenteeism, agency usage, and overtime. Nursing is the biggest expense in healthcare, period. Enhance quality improvement practices. Again, you get patients and nurses together, your quality improves. Simply put, we give you superpowers. I'm going to click out here and take you out onto the web. Here's what our web page looks like. It's nice, it's easy, clean,